Hello, welcome to my channel. Today I would like to talk about intimacy during breast cancer treatment. This is a very interesting and very important topic that I wasn't aware myself when I was diagnosed with breast cancer 2 years ago. Being part of different online support groups, I also figured out that a lot of women around the world are not familiar with this topic, and even their doctors don't talk with them about intimacy. It was the case with me, so my oncologist was not very eager to talk about this, neither before, during or after my breast cancer treatment. So it seems like this is a taboo topic. A little disclaimer. I'm not a medical professional, so all the information that I'm going to talk about is based on my personal experience, but also research that I did during my cancer treatment and in preparation to this video. So if you have any specific questions, go ask your oncologist. So what is breast cancer? Breast cancer is a disease in which breast cancer cells grow with abnormal speed, forming tumors. Depending on the type of breast cancer, so there are different stages of breast cancer and different types of breast cancer, different women would experience the results of breast cancer treatment individually. So the side effects will differ from one woman to the other. The most common side effects during breast cancer treatment are nausea, vomiting, diarrhea or constipation, or both, extreme fatigue and pain. I experienced most of those side effects, and well, it was not really pleasant to go through your day with these symptoms, and as a result of side effects, your self-image plummets. You don't see yourself as you were before, and you start losing control of your self-image. For many women, breast cancer treatment creates a bunch of symptoms that prevent them from having a normal, intimate life. One of the biggest symptoms is loss of libido. It means that you don't really want to have sex because you feel so tired, or you have all of those side effects like vomiting and having diarrhea, having pain everywhere in your body, that of course, like your mental, like your psychological state brings you to this flight or fight mode where you're fighting for your life, and this becomes your most important function. So you obviously don't think about having sex, about wanting to have sex or to be intimate with your partner. Then another symptom that brings a lot of joy to a life of a breast cancer patient is menopause. In my case, I entered menopause after the second chemotherapy, and I have to tell you, it was not really pleasant. So I personally experienced hot flashes, mood swings, extreme mood swings, and also vaginal tightness, which is also called vaginal atrophy. So it's like another layer on top of everything else that is happening to you. So definitely you're not thinking about intimacy during this time. And then there is also hair loss. As a side effect of breast cancer treatment, a lot of women lose their hair. So for some of them, it's very tightly connected to their identity, to their femininity, also depending on the culture and society they live in, and losing their hair can be very, very painful and can directly impact self-image in a very negative way. So now when we look at this beautiful rainbow of all the side effects and symptoms coming out of breast cancer treatment, so you can imagine that it's not very easy to, first of all, maintain your integrity as a person, to have very high self-esteem, and being very open to the world and to your partner. So intimacy is something that suffers quite a lot during breast cancer. And so here I would like to bring up a few strategies on how to help you maintain or rebuild your intimacy during breast cancer treatment. The most important part is communication, and this is something that suffered in my relationship, and that's why my partner broke up with me. He failed to connect with me emotionally, to understand what was going on with me, and I would like you to avoid this mistake. So the disease actually creates a huge gap in the relationships, because you as a patient going through all of this like horrible chemotherapy, being emotionally exhausted and physically exhausted, so you lose everything which connected you to the person you were before the disease, before the diagnosis. And so it's very important to communicate to your partner what changes you're going through, how do you feel, what are the physical and emotional sensations in your body and in your mind. And I also want to address those whose partners are currently going through breast cancer treatment. Ask them questions, as many questions as you want, because you may lose them during this fight. It's important for you to understand what do they feel, what fears and horrors are going through their head. You want to understand the sensations in their body, you want to understand their emotional state. Also, go to the internet, go online, research, read some scientific papers, watch YouTube testimonials of breast cancer survivors. Try to understand what is going on with your partner right now. Give yourself time to adjust. Be kind to yourself. If you just started this treatment, there is still some way ahead. Maybe you will have a surgery, maybe you have radiotherapy. So all of this will impact how you feel and how your body feels and how you feel emotionally. So just say to yourself that it's fine to feel like you are feeling right now. Things will be better. Things will definitely get better. But you just need to pause for some time, listen to your body, and give yourself space to heal and to recover, to adapt to your new self, to adjust your life to this new person who you are now during this treatment. Very often during breast cancer treatment, women experience vaginal dryness and vaginal atrophy. This is unfortunately normal, and this can lead to a painful sex. In my case, it felt as if a knife was inserted inside my vagina, and when I browsed different support groups, that's what the majority of women reported too. So penetrative sex is extremely painful. So what I would advise, and what many couples try to do, is to explore alternative ways of intimacy. It doesn't need to be penetrative sex. It can be cuddling or kissing or giving each other massages. Maybe you want to experience something new together, start a new hobby, or go for walks together. Create this nice routine that will allow you two to reconnect. Seek professional help. You may reach out to your oncopsychologist, to a psychologist, psychotherapist, your oncologist. Most importantly is to talk to medical professionals about the issues that you experience, and more likely they will help you in one way or the other. As a result, you may get help either in form of different gels, lubricants, pills, or specific strategies on how to handle the question of intimacy in your couple. Don't underestimate mindful practices. From the moment you become aware of something that is going on in your body and mind, and you process it and you manage to communicate this to your partner and you act on this, it brings you closer to yourself and one step closer to the recovery. Also, meditate if you know how to, or if you don't, learn this very cool technique and it may truly change your experience of breast cancer treatment. And don't forget that each day brings you closer to the recovery. Understanding what is going on with you and what can you do right now to feel better, to discover intimacy with your partner, can be really, really uplifting. Breast cancer is a bitch. It can hit really hard. But what's important is that when you maintain your integrity, when you communicate with your partner, when you help each other, like these little bits every day, improving the quality of your relationships, trying to explore what's new intimacy for you is during this treatment, then you will grow much stronger together.